Welcome to Entrepreneurs in Healthcare. I've come to realize that entrepreneurship discussions are long overdue in medicine. I'm pairing up with voices from healthcare that value entrepreneurship and that are willing to come on the screen with me and hold a discussion. I'm hoping that hosting these conversations will open up pathways to making progress in medicine and not making entrepreneurship a bad word. Join along on this series as we dissect entrepreneurship, healthcare, and everything in between. Hi, everyone. So welcome to another episode of Entrepreneurs in Healthcare with Dr. Corriel. And I am excited to have across from me virtually Dr. Shane Purcell, who I have been hobnobbing with online, mostly in a Facebook group for quite some time, really for a number of years, and finally have the pleasure to not only have him as a guest on this show, but also to have him as a speaker in one of our upcoming virtual live conferences. And I'm going to talk about that a little more into the episode. So, Dr. Purcell, welcome. And before
Thank you.
we ask you the main question, I would love for you to introduce yourself so our audience knows who you are.
Very good. I'm Dr. Shane Purcell. I'm a family physician in Anderson, South Carolina, which is about halfway between Atlanta and Charlotte, for those folks who don't know where the small town of Anderson is, but fairly rural area in South Carolina, and did my training here and just stayed around the area when I graduated from residency back in 2002 now. And then did some private practice for a couple of years, and got disillusioned pretty quick in that. And I'm kind of have the entrepreneurial itch and the entrepreneurial bone, and so I kind of like to do things my way, and the way things feel like they should be done to me. And so I I did urgent care for a while, and then started my own clinic. And back in 2015, partnered up with Dr. Amy, and we did the first direct primary care clinic in our area. And now it's growing by leaps and bounds as doctors find their way out of the system and into the entrepreneurship of direct primary care.
So you're somewhat of a pioneer. Would that be safe to say?
Some people say that, but I learned from a lot of other people who took a lot of other arrows, and they helped me. And that's one cool thing about the DPC community is it's a very helpful community. So if you're in primary care and you want to do your own practice, and DPC is something to think about, there's a lot of people willing to help, give you a hand up, because a lot of people help them get started. So it's a really helpful group, and it's just a great group of folks who really believe in helping one another to learn how to get it done and get out of the system and help yourself, help your patients, help yourself, because it's not fun. Some of those jobs are terrible.
So before we actually get into that conversation, which I would actually love to have, let's ask you the question of the hour, because we do usually lead with this question, and that's, is entrepreneurship good or bad?
Well, my take would be that I think entrepreneurship is great. I think you have to have the knack for it, I think. And I don't think, I wouldn't say it's for everybody. There's certainly people who um, do better in working for someone, or, they don't want to deal with the business side. But I think as far as healthcare, specifically healthcare and primary care, where you're having a relationship one-on-one with a patient, and you're trying to do what's best and right for that patient, um, having an independent physician that's working for themselves, working for their patient, is probably the best you can hope for in a healthcare situation. Is if you're working employed, or you're working for a hospital system, or God forbid, a corporate practice, or a venture capitalist group, a PE group, you're kind of stuck doing what they tell you to do. And so your physician may not work for you. And Those are the things that we really don't like. We took an oath. All of us took some oath when we graduated from med school, and those are going on right now. And there's medical students across the country who are taking oaths. And so, what is that oath is usually to your patient to do what's best and right for the patient, not for an administrator or some other person who's over you. So I think entrepreneurship and doing that for yourself and for your patient, you have ownership in that. What goes on in your office is the best way to do that primary care healthcare for me.
Yeah, and I actually think my personal take here, obviously, if you're listening to the series, then you already know that I am for entrepreneurship in healthcare for the most part. Obviously, there's caveats to every opinion out there. But my sort of take on it is that, you said earlier that it's not for everyone, and some people want to continue being employed. My take on it is that entrepreneurship can be looked at as a mindset versus an action point, right? Meaning, what
Right.
you've done is that you've not only taken on the mindset, but you've also taken action on that mindset in your particular circumstance, and you've created a DPC practice where you are the boss. But my thing is that I feel like doctors need an entrepreneurial mindset, whether or not they work for somebody, because you can continue working for somebody and still utilize the concepts of entrepreneurship to just protect yourself, to make sure that you're not being taken advantage of, to make sure that generate branding concepts and marketing concepts that normally you wouldn't do if you did not have an entrepreneurial mindset, and then get completely taken advantage of by an employer. Does that make sense in any way?
Oh, 100%. I've heard it said many times, listening to certain podcasts and things out there about, even if you're working for someone, it's still your business. You're the physician. It's your name, right? And whether you leave that practice or move to another practice, even if you're working for somebody else, you're carrying that name with you. And you should try to have your brand, keep your brand, because ultimately, I hope as a physician, that's why patients are coming there. They're not coming because Walmart owns the business, right? They're coming there because it's you. You're the doctor. You're who they're coming for. So hopefully people would take that to heart too, that you are the business too, whether you want to run your own business or not. And there's other opportunities. Maybe you get into real estate, or maybe you get into teaching or doing something else, which is a different type of business altogether.
I think that over the years, the giant conglomerates in healthcare have done a really good job. And I'm using air quotes here if you're listening on a podcast. They've done a really good job of, I don't even know how to describe it really, because, you know, they've done a really good job of almost like lumping all of us together under their one giant roof. So an employer will, take their hundreds, if not thousands of employees and almost like make us just their employees. And you kind of lose your identity when you work for someone else. And, that's sort of been um, at fault for making us equal to, for example, mid-level providers. A lot of giant corporations, for example, will kind of, I don't know, like lessen our degrees and lessen just how much we've learned, and almost equate us with others that are coming in that maybe get paid less than us, and that's a whole different argument for a different episode. I'm not looking to argue. I'm just kind of looking to paint an entrepreneurial concept that the giants are using to almost like erase all of the hard work that we've been putting into earning our medical degree. Do you have anything to say about
Oh,
that?
yeah, I agree. And to stretch out even a little bit further, when you're, and talk about the corporate practice of medicine and these private equity groups that are coming in and buying up practices, a lot of states, most states have a corporate corporate medicine policy, and they have to have a physician to sit on the board. They have to have a member, and it's almost like they're renting their license. And so there's a lot of animosity there from other physicians because that doctor's really not doing any not practicing medicine. They're just allowing that entity to own these businesses. So there's definitely, and they're selling their license. They're giving that away, and kind of cheapens all the hard work we did to try to become physicians and help patients. So I mean, I wish we had a better way to enforce the corporate practice of medicine, or if it was stronger enforced, so we could have more physician ownership in practices. And not only that, but there's the whole other side of hospitals, and we can't even own hospitals. Anybody can own a hospital in the United States except a physician, which is, the janitor could own it, which it doesn't make any sense to me.
It doesn't make sense to me either. I mean, someone really has some strong lobbying power. That's what it all translates to, and we all know it, right? We
Yeah.
all, for the most part, grew up in America. We know how it works, and it's following the rules. It's the rules that are established that get put into place. And how do the rules get put into place? Through lobbying. So I agree with you. I think it's absolutely ridiculous. I think that rules and regulations can easily be put in place without restricting a physician from owning a hospital. It makes no sense. When you are a store owner, you can surely work in the store. I don't understand it. And I particularly don't understand it because it's not like hospital systems are, you know, a lot of them call themselves nonprofit, but again, their CEO and their top admins are making millions per year. And so again, you try to kind of understand that whole scenario. It makes no sense. And at the end of the day, really, it makes no sense that a doctor is in charge of the healthcare relationship, and yet they can't be in charge of the entire transaction that's happening to the patient. I think that patients actually would want the doctor in charge. What is your experience from the point of view of being a boss in your practice, in terms of how your patients respond to that?
Well, I mean, we tell our patients just like we tell our staff when we bring in new staff or hire staff, and one of the selling points, if you will, is that the buck stops with us, so to speak. So because we do get a lot of employees who come from the hospital system, and they're super frustrated because other than just piling more work on them, they can't get the help they need because it's, oh well, I'm your boss, but that has to go 6 levels up to get this approved. And so we do the same thing with our patients. It's, we're independently owned. Dr. Amy and I own this practice, and so we're here to help you. And if you have problems or questions, you come to us. You don't have to go. There's no 800 number you call, or there's nobody above us. So we would try to help work that out. And that does, as an entrepreneur, that does can put stress on you, because if there's a situation or a bad review or something that comes up, it does put it in your court, basically, to try to handle that as best you can. Um, but it does we have a lot of patients who come here because we're not affiliated with any kind of hospital system, or that we are self-employed, and that we own our own practice, because in our community, 95% of the practices aren't like that. They're basically owned by the hospital system. So, and people are looking for, other places to be. So I think that gives us a little bit of benefit. We try to share that with our patients, that, we're hardworking folks just like them, and we're trying to do what's best and right for them. And I think they find that helpful for them.
I want to spend a few minutes talking about the whole concept of DPC. I don't want to spend too long on it because this is more about just the general entrepreneurship, but I do want listeners, whether they're other physicians or members of the general public that are just like, what does that acronym actually stand for? Can you explain what DPC is? And then I have a few questions about how it runs to just give people an
Mhm.
idea of, this other type of practice.
Sure. So it's DPC is direct primary care. That's been the term probably for about 20 years now, roughly. There's been little bits and pieces about people trying to change it to direct physician care or other little terms, but in the legally, because there's about 35 or 36 states that actually have direct primary care laws written, and so it's spelled out as direct primary care. Um, so it's basically a membership-based medicine. The simplicity of it is instead of dealing with insurance, you pay a monthly membership and you get direct access to your physician for ultimate access. I wouldn't say it's 24/7, but it's about as much as you can stand to bug your physician. We allow our patients to text and email us. Most DPC do that for their patients. So text and emails, video visits, in-person visits if you need that. Some folks do home visit. It allows the doctor to have wide variety on the things that they want to do and practice, how they feel comfortable, whether it's home visits. Some maybe just focus a lot more on women's health or sports medicine and do joint injections. And you can have, open range to the things that you want to do, sort of craft the practice the way that works for you. And so we're outside of insurance. The beauty is we don't deal with insurance, so it's basically one-on-one with the patient. The patient pays the bill, pays our bill, or if it's employer, we do have some small employers that sign their company up, and so the employer pays, and sometimes the employee's still paying some out of their pocket, but it's basically a membership every month, and then you get the access that you need, no copays and discounted labs and meds, everything we do here, almost everything we do in our clinics included with that. So if you needed an EKG or, a little cryotherapy to your skin, we just do it and we don't even bill or do anything extra about it. So it's a really comprehensive way to do primary care. We get the biggest thing is time. Our biggest issue that primary care struggles with is time. And so this allows us way more time to spend 30, 45 minutes with a patient so that we can go through grandma's whole list of 10 things she wants to talk about instead of just one or two and come back in 2 weeks. So we really try to focus on spending time with our patients, which they feel like they get their money's worth. And we feel satisfied because they got all their questions answered. They don't have to come back, and then they can text us later if they forgot about something.
So I'd love to cover some of the technicalities of it just to give people
Uh-huh.
like a better picture of that. So how much does that run a patient monthly?
So the national average is about $77. So it's a lot of patients, a lot of clinics separate that out by ages because that's the simplest way to do it. So if you're younger, maybe it's $60 a month. If you're older, maybe it's $80 a month. And so they have age ranges. Some there's a clinic here in town. They just do $79 flat across the board. That's what it is. So on average, around $75 to $80 across the country, and then you don't pay anything when you come in. So if you have to come in, if you're really sick and you have to come in multiple times, you pay no more that month, no more to text or email. And most of the services we do here are included in that monthly fee.
And what happens when somebody needs to be hospitalized or needs care that is expensive? For example, develops a chronic illness or
Mhm.
heaven forbid cancer.
Right. So we encourage those folks. So we don't like insurance and we don't use it in our clinic, but it is a necessary evil for emergency, serious emergencies, cancer, major surgery, those kind of things, hospitalizations, obviously. So we would talk to our patients usually when they first come in, like, hey, if they have insurance, we would tell them, hey, we're going to help you navigate the system. So if you needed to be in a hospital, we will help you get there. We'll help you get through that. You can text and email through the whole process. And if you needed imaging, any kind of testing, we usually spend a lot of time trying to get the best deal we can for them, because sometimes it's not using insurance. In fact, many times it's not using insurance. And many times it's imaging and procedures and referrals outside of insurance that can save them a lot of time and money. So we do a lot of that navigation work for them. We've been doing it for 10 years at our clinic, so we know our community pretty well about where to go um, for imaging and specialists and that kind of stuff. But you do need, I use a health sharing plan. So we tell people about health sharing if they haven't heard about that, because that's a pretty good way to cover catastrophic things, because right now it's very hard to find a true catastrophic insurance plan that'll help you cover the big stuff. So we tell people, think of us as, if you think about it like car insurance, car insurance is there when a tree falls in your car, not when you change your windshield wipers or get an oil change. And we're the windshield wipers, the oil change, the simple things that is coming all the time. You got to put tires on your car, they're coming. So be ready to pay for that and use the insurance for the big stuff. And so we do spend a lot of time trying to educate people on, you don't need this high dollar insurance with thousands of dollar deductibles. You just need to be smart about that, and let's see how we can help you figure that out.
That makes so much sense. I always think about that. I think about why insurance is something that we use nonstop to just see doctors, even for general care, when the whole point of the word insurance is that it sort of protects you in case. It shouldn't
Mhm.
be in case that you go get, your annual visit. That's not in case. That's every single year. So I love that, car metaphor. The question I have, I guess, is how did we get here? I mean, how did insurance sort of evolve into this beast that basically controls our life where it comes to health? We'll be right back. Private Practice 101 is the latest in virtual conferences you can access on our site.
I'm going to talk to you about lease negotiations and purchase negotiations.
I'll talk about how to prepare, plan, and organize your personal finances when you are starting out on your own private practice.
We're going to talk about how to apply this information to detect and prevent fraud.
This talk is for doctors who are fed up with the overregulation of patient care.
And I'm excited to teach you the ins and outs of how to build a thriving referral network and Facebook group.
And how to build in compliance efforts and strengthen your negotiation tactics. Because I want you to make money and I want you to stay safe.
I'm really looking forward to talking with you about creating and retaining a high-functioning team.
About the psychological and emotional things that undoubtedly come up as you reach certain barriers.
Marketing yourself as a professional in the world of today.
Form a virtual corporation and use your practice skills in a virtual environment that allows you to thrive without having to worry about managing overhead, managing a staff, or even managing a building.
Top mistakes in credentialing and those key metrics you're going to want to monitor in order to increase your revenue in your practice.
How to overcome your fear and move from your medical practice now into a private practice.
I'll share 3 distinct skills that when you use them, you can create and maintain a long-lasting, passionate marriage while becoming a very successful practice owner.
My talk called Creating a Vision and Applying It to Build Your Practice is going to help you streamline your process and create the practice of your dreams.
Stop trading the value you provide to patients for cost.
I'm going to teach you how to learn your value and your worth, how it is you get paid and what you actually cost, and how to train your sniffometer and know when to leave.
Access this valuable resource at doctorsonsocialmedia.com/conferences. Now back to the show. How did we get here? I mean, how did insurance sort of evolve into this beast that basically controls our life where it comes to health?
Yeah, I think you mentioned earlier, all those lobbying groups, the hospital groups and the insurance groups and big pharma, it's a 4.2 or $3 trillion business, and everybody wants a little piece of that pie. And I think, obviously insurance started a long time ago, and it's just gotten bigger and bigger and bigger. I certainly feel like the Affordable Care Act, when it went through, I guess 10, 14 years ago now, it certainly made things worse, because it mandated coverage, and it did a lot of these mandates, and it made the there's a thing called medical loss ratio that forced insurance companies. And the only way that they could make more money was the rate, keep prices going up and keep everything going up. So it just made it worse. It's not made it better at all. So um, it all comes down to all these to me, from it's the mandates and the government people getting their hands in, and they may have had good intentions. There may have been every good intention that Obamacare was, Affordable Care Act was going to be great, but it just never seems to turn out that way when the government and people with their hands in their pocket get into it.
I think that most issues in life either have a good intention or can just be marketed and spun in a way
Yeah.
that shows that it has a good intention. I'm not specifically talking about this case. I'm just in general noticing that, especially now that I'm so active in entrepreneurship and in marketing. I just really see how strategic companies can be. I mean, companies that are very wealthy have enough money to literally hire teams in order to put spin on things. It makes me actually think of the show that I really loved watching. It's over now, but Succession. Have you seen that show?
I haven't. Where can I watch that at?
I think it was on HBO, but
Oh, okay.
it was, yeah, I loved it. It was a great, show about this really wealthy media company and the way that they spin things around. It was about, the children being kind of wealthy and snobby. Everybody had their own personality. But anyway, okay. So that brings me to our upcoming conference, which is exciting because even if someone's going to watch this or listen to this after the conference goes live, they can still purchase access to this conference. And it's called Private Practice 101, starting out on your own. And you are in the lineup. So congratulations, firstly.
Thank you. Thank you.
Of course, it's a pleasure to bring you on. I'm excited. And I actually want you to tell everybody about what you're going to be speaking about.
So a lot about what we're talking about here, entrepreneurship, I mean, is the big topic, but basically there's a lot of fear around that. And so I want to give just a little bit of hope. Basically, my talk is called Hope. 7 ways to overcome the fear of entrepreneurship. So there's other tidbits in there too about, there's some healing that we talk about because a lot of people have been abused in the system, and how to, what's your first step to try to, get out of that. And then overcoming the fear, things to think about, because there's the economic fear. People are like, well, if I do my own thing, how am I going to make money? I still have debt. I still have school loans I'm paying for. I'm the breadwinner for the family. Where's the money going to come from? There's just fear of the unknown. Like, I don't know how this is going to work. There's certainly there's other economic fears, business related. Like, I don't know how to run a business. So just going through some of those fears and thinking about things, how it affected. I used to own my own urgent care center that I started from scratch for 11 years, and things I learned going through there, and I've learned in direct primary care, running my own business. Little piles of poop here and there, you just step in to try to give people tips, like, hey, watch out for that, and to overcome some of those fears of how to do the entrepreneurship. And again, it's not for everybody, but I think most folks can do it. If you got through biochemistry and you got through all the hard things, physics, you can learn how to do QuickBooks and some simple things and run your practice. And it's I say they, the system and administrators, people who have abused us in the past, have told you can't do it. You need our money. You can't work for yourself. And how many of you probably heard this before? How many have been told that doctors aren't good at business? They don't know how to run a business. That doctors make poor business people. So that's been a long held stereotype, but I don't know that there's a lot of truth in that. There's ways that hopefully we can work through and at least give people a glimmer of hope to say, hey, I could probably do this. There's people out there that can help me. The beauty of the DPC community, our direct primary care community, is that there are a lot of people who are willing to help you. And so you don't have to do it alone, right?
Yeah, and there's this recurring theme that keeps coming up in these conversations, and that's that that overcoming the fear of entrepreneurship. You're going to speak about it at the conference. It also came up in the episode that we actually published today with Dr. David Keynes, a urologist, on our Side Venture series, where he is a different kind of entrepreneur. He talks about being an entrepreneur of a healthcare startup, but talks about the same thing where when he started, he just was like, you know what, but I'm not an entrepreneur. How can I do this? I don't have an MBA. And it's so relevant to what you say because he says the same thing. He says, just do it. Like you did so much already. You absolutely can do it. So that's comment number one I wanted to say. But comment number two that I wanted to also say was that, you know, you're talking about the steps that are needed to build either your own practice or an entrepreneurial venture, however it is that you want to be entrepreneurial. And it makes me think of the younger generation, the students that are going through the process and that are not taught any of this. And it's why I've built a new student section into SoMe Docs, because I feel like people like you need to be connected to the students, but because you're not academic and you're not tied into a big system, the students are unfortunately not getting to hear from you and they're not getting to learn from you. And there's so many learning lessons that they can be getting from you, from me, from our colleagues who have done it themselves, that I really do want to facilitate those connections and really get us to start, I don't know, building like a brain hive of both physicians and physicians to be so that we can make a difference for the future. What do you think?
This is a huge topic for us.
We'll be right back.
I've watched you unfold too in your writing.
I know it's a terrible burden and you'll get shat on, but we'll have a good time.
Yeah. If we answer that question and the answer is yes, we value money, then we're doing everything just right now.
Oh, because the food is really good, that the hospital's really good.
Healthcare workers have been always stressed, but of course, above and beyond.
At this age.
To learn.
Yes, the disparities still exist.
People in the C-suite, the corporate people, they don't care. To them, doctors are just employees.
And that's what people have really responded to, the authenticity.
All I really wanted was to come to work and feel like I was rowing in the same direction as everybody else.
Like, you could be a doctor, you could be someone who works in a parking lot for the hospital.
It is not uncommon for people to put aside their personal life.
I could never speak like that.
But we are not listening to the why.
How are you working to co-produce solutions?
And he said, all well and good, Dr. Vonnegut, but if the dollars work, nothing else matters.
You know, when I started medical school, I was the only person who looked like me in my medical school class.
Something about the struggles of men and friendship sort of as they age.
And people hate it when I say this, like, you're just scaring me. I can't do anything about this.
And I had my threadbare blue blazer, and they all had these $1,000 suits.
Tearing something down in order to get to what's real and important.
Because we had to march across the bridge, one of the biggest marches ever.
They would only pay me half of what they were paying me now.
But it's true, I tell you or not.
No, you don't have any choice.
I need to promise you that it's not over.
I called my wife and said, I need new clothes.
Good connection is good medicine. That's the one phrase I've come up in my 76th year, I think.
You can find this amongst our series in doctorsonsocialmedia.com/series. Now back to our show.
This is a huge topic for us, especially in our, I'm also on the board for the Direct Primary Care Alliance, and we just started a residence and student section, and it's very difficult, as you say, to get into. And I think we have a really good direct primary care doc who's basically trying to get us into the student side, into the medical schools to speak, and to residencies to speak. It's very difficult to penetrate the system. because they don't like outsiders coming in, and I don't know if they don't want us to give them hope. I don't know what their thing is.
Well, I think we both know what they don't want.
So they want to keep the students and the residents for themselves so they can handcuff them and keep working. And so, but we've been very frustrated, but we do attend, there's a national conference, the American Academy of Family Physicians, the Family Doc Organization for America. There's a national conference. I think it's coming up in in August. And so we'll have a table there, and we really go and we speak to the students and the residents who come to that. So that's a place that maybe Sobe docs can get into and have some influence. Certainly it's harder to get into organizations, but there are other student-led organizations like Benjamin Rush Institute, which I've spoken at before. I think it's just hard to penetrate the system because they don't want outsiders coming in. We are trying desperately as a national group of direct primary care physicians. We're trying to help them, and we do have a lot to come to our conferences. So we give free scholarships to come to our conferences. We're going to some state conferences this year, like North Carolina and Asheville, North Carolina. The North Carolina Academy has a huge conference, and they have a ton of students and residents come. So we're trying to seek out places where we can connect, but it's not easy. But it has been a major focus for us as an organization. And just, I can do what I can do here locally. I go once a year, me and my partner, we go and speak to the students here at our local hospital system. They won't let us in to speak with the residents much, but we kind of go underground, and we know some of the residents, and we just, hey, come over and let's have pizza and beer, and let's talk about, independent practice. And so we do that a couple of times a year to let them ask questions because they're not getting that information.
Well, we're doing some of that with SOME docs for sure. I mean, the solution for me is social media. So, this is why we now have built so many different virtual conferences that are going to not only go live, but are free while they're live. And this way, they don't cost, there's no overhead for anybody to join. And that includes the students, whether they're joining as members of SOME docs or not. They can certainly come in, and even the private practice conference that's coming up with you in it is an example where students can join for free, can learn all about private practice, whether, regardless of which medical school they go to. Even pre-meds are welcome to come and join. And this way they can become acquainted with all of the different organizations that are out there and the different movements. And for example, if they hear you talk and they kind of hear about the DPC movement, they can then make that connection and follow you along. So I look at it as we are all kind of links in a chain that lead to one another, and that lead towards change. Another conference that I am building that is going to come up is a healthcare conference. So just the general healthcare niche, and what the different organizations, the grassroots organizations, the bootstrapped organizations, they just don't have enough money to market, and they don't have enough amplification. So I think building something like a healthcare conference that's virtual and live is, different than the private practice topic, but is also super important to bring us together so that everybody can get a chance to sort of let everyone know what they're building. And we can that way penetrate those walls that are not allowing us to change healthcare actually for the better. So with that said, I would like to close this out. I mean, you're certainly going to be welcome to come join us again at, in our series, certainly in different series as well. Is there an ask that you want to leave us with before we close the episode?
No, I think the biggest thing that you've been saying is share your entrepreneurship with other people. Let people know what you're doing. That's what we try to do. I just came from a conference this past weekend where there were 20 docs that are stuck in a system, and I spent all day Friday and Saturday teaching them about how to get started in direct primary care. And it's me and several other physicians in the Atlanta area. And so, try to get out there and share with other students for sure. If you have students in your area, if there's a med school in your area, if there's a residency in your area, see if you can get in and talk to them. Try to go talk to them and let them know that, hey, there is another option. You don't have to be chained to the hospital system. You can do private medicine. There's other things even outside of medicine you can do if you feel like you're just burned out and done with it. I would prefer people try to stay in medicine because we need doctors. We need people to take care of people. But you can still share your experience. There's so much you can give to students and get them in the right direction, and residents too. So, reach out to those people in your community and spread a little bit of hope around there if you can.
Wonderful message. I absolutely agree. And yes to staying in medicine. I do think that so many people are leaving, and it's just so unfortunate, either leaving or looking for side ventures, or, and it's our job as a society to think, why is it broken, rather than, blaming people for leaving. It's, let's think as to why they are leaving, and can we make it a better space where the doctor is happy and the patient is happy. So I'm certainly glad that were able to find that where you practice. We didn't even have time to really talk about the different states. I know that there's different states that have different rules and regulations in place. So I'm sure that sort of limits how much you can practice privately. But why don't we save that discussion for the private practice conference that we have coming up? It's taking place May 31st to June 2nd of 2024. But again, if you're listening or watching this after that date, you can certainly purchase access to that after the fact. So, Dr. Purcell, thank you for joining me. And I will include show notes with your profile in it so that people can send in an inquiry and connect with you to get more information about DPC and anything else that they need. So thank you.
Well, thank you.
Thanks so much for listening.